Hi, my name is Heather Walker, and I will be talking about health issues in rural populations. Rural describes areas with lower diffuse populations. In the United States, approximately 15 to 20% of our population lives in rural areas. There are a variety of population health concerns, but some of the health issues that are prevalent in rural areas include cardiovascular disease, substance abuse, mental health, and suicide. Cardiovascular disease. Data from the CDC shows that there is a 40% higher prevalence rate for cardiovascular disease among rural residents than urban residents. Rural residents have a 30% higher risk for stroke mortality than urban residents. There's a higher rate of hypertension in rural residents than urban residents. A study by Harrington et al. Reports that 29% of rural residents have hypertension compared to 22.8% of urban residents. Some risk factors that affect these statistics. There is increased tobacco use. Data from the Behavioral Risk Factor Surveillance System suggests that roughly 1/4 of adults living in rural counties report active tobacco use. There's an increased incidence of obesity and type 2 diabetes and decreased access to health care. Substance abuse. Opioid and substance misuse is more prevalent in rural areas than urban areas. There's a higher incidence of opioid-related deaths in rural areas. This may be related to decreased access to emergency medical help. The ratio of non-medical opioid users to medical opioid users was higher in rural areas than urban areas. And there's an increased rate of opioid prescribing in rural areas compared with urban areas. This may be related to rural residents being generally older and suffering from chronic pain. This may also be related to lack of pain management options or holistic treatments in rural areas, things like acupuncture or massage. Rural areas have generally a decreased access to mental health. Less than 10% of mental health professionals work in rural areas. Mental health and suicide. In 2020, there were almost 46,000 deaths from suicide in the United States. Just an amazing number there. The suicide rate in rural areas is twice as great as in urban areas. Men over the age of 85 have the highest suicide rate in rural areas, 60.2 per 100,000. A survey conducted in 2020 reported that 20% of non-metropolitan adults reported having mental illness. And data shows that rural residents have decreased access to mental health services, primarily related to location and lack of health insurance, and them being less likely to seek mental health issues due to the attached stigma from what people might think about them if they admit to having a mental health issue. Implications for practice. There's an increased need for nurse practitioners, especially in rural areas. So it really does increase the job market for nurse practitioners. There is an increased need for knowledge on treating patients with substance abuse and mental health disorders. This project has really opened my eyes on the issue of mental health in rural areas and increase the awareness. So I think it is something that we need to focus on and help work towards resolving or helping that health inequity there. There's a need to address social determinants of health. Social determinants of health affect health equity. It's important for us as providers to consider these social determinants of health to help drive the patient's plan of care and address barriers in those barriers for them achieving their goals and promote better health outcomes. These issues also increase the urgency for need for full practice authority for nurse practitioners in Michigan to help the medically underserved populations and reduce the provider to patient ratio and improve healthcare outcomes overall, and to work towards the goal of population health. And here are my references.